Hello, and thank you for taking the time today to join us for this informative webinar about psychiatric mental health nursing in academia. My name is Lindsay White, and I am a Senior Product Marketing Manager here at Jones & Bartlett Learning. For those of you not familiar with Jones & Bartlett Learning, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets. And we particularly specialize in nursing and health and safety. Today, Dr. Jeffrey Jones and Dr. Audrey Beauvais will highlight the current state of the art of psychiatric mental health nursing, both from a curricular and a clinical perspective. We'll learn more about how a return to nursing theoretical underpinnings in curricula and practice actually enhance and strengthen clinical decision-making. But before we jump in, I am pleased to introduce our authors and presenters today. Dr. Jeffrey Jones is an ANCC board-certified psychiatric clinical nurse specialist, psychotherapist, an ABA-approved legal nurse consultant, and an entrepreneur. He most recently was visiting faculty at the University of Akron in Ohio, and he is well published in the area of psychiatric mental health nursing and nursing theory. He is the recipient of multiple awards, including the Mildred E. Newton Distinguished Educator Award from the Ohio State University in 2021. Dr. Jones was previously Chief Nursing Officer for the Ohio Hospital for Psychiatry, and he has served on the Richland County Mental Health Board, the Ohio Board for Nursing Standards and Practice Committee, and as a content expert on psychiatric nursing for the ANCC. He is the past president and owner of Pinnacle Mental Health Associates, a private practice in Mansfield, Ohio, and he is the current owner of Jeffrey S. Jones, LLC, a psychiatric APRN contracting company. Dr. Jones has provided service to the mentally ill in hospital settings, outpatient clinics, prisons, and in private practice. And Dr. Audrey Beauvais is an associate dean and associate professor at the Egan School of Nursing and Health Studies at Fairfield University in Connecticut. She has been teaching undergraduate nursing students about psychiatric and mental health nursing for over 15 years. She was recently elected to the National League for Nursing Board of Governors and is an editorial board member for the journal Nursing Education Perspectives. Dr. Beauvais has also received several honors and distinctions throughout her career, including the Connecticut Nurses Association Diamond Jubilee Josephine A. Dolan Award for Outstanding Contribution to Nursing Education, the Connecticut League for Nursing or CLN President's Award, the CLN Leadership Award, the CLN Ruth M. Olson Excellence in Nurse Education Award, as well as Sacred Heart University's Dean's Leadership Award. Prior to her time in academia, Dr. Beauvais worked in various leadership positions at Stamfield Hospital, including nurse manager of the psychiatric and pediatric units, case manager, and performance improvement coordinator. She was the magnet coordinator that successfully led Stamford Hospital to be recognized as a magnet hospital. And we're also honored to work closely with Dr. Jones and Dr. Beauvais on the third edition of Psychiatric Mental Health Nursing and Interpersonal Approach. And speaking on behalf of the team here at Jones & Bartlett Learning, we do know how lucky we are to work with such distinguished and accomplished authors and educators. So without further ado, I'll pass it over to Dr. Jones and Dr. Beauvais. Thank you both.
Well, thank you so much for joining us today. One of the first things I think we want to just kind of introduce ourselves further by talking about how Dr. Beauvais and I ended up working together on this project. It really was kind of a nice separate journey that joined into one. And it began way back in 2013 when I was chosen to be the lead editor on a psychiatric and health nursing text that Dr. Beauvais actually contributed a chapter to. And she did that through the first and second incarnations of that book. When the third opportunity to do a third edition presented itself, and I needed a co-author to help me be an editor on that edition, the choice was pretty obvious due to Dr. Beauvais' strengths, not only in academia, but also clinical-wise. And it really felt to me like a perfect balance, the coming together of an expert clinician and an expert academician to kind of produce this product.
So thank you, Dr. Jones. Jeffrey, it's been lovely to work with him, and he's got such a rich background. If we can go back to that first slide just one more time, Lindsay, thank you. He's got such a rich background in that clinical expertise, and what I kind of lend to it, although I do have expertise in mental health nursing, but more of the academic side. And we were noticing a lot of change in nursing curriculum. So some of you out there who are nurse educators who are teaching mental health nursing, or in academia in general, might be noticing, certain changes in academia. Some of you might be changing over to a concept-based curriculum. As many of you notice, always new topics need to be included in our curriculum. We never take content out, right? So for those of you teaching in this content area, you might notice that we talk about trauma-informed care and that now needs to be in the curriculum, health disparities, inequities. If any of you went to the National League for Nursing Summit last month, you saw a big focus was on climate change and how climate change influences health and health outcomes. Those of you also might be noticing the new AACN essentials that need to be included in our curriculums. The NCLEX Next Gen will be implemented this spring, and that's including a big focus on clinical judgment. So in academia, we've got all of these things that are going on and need to be included and taught to students. But also what I was noticing when Jeff and I came together in academia is that we need to keep caring at the center of all that we do. And we need to focus on the relationships that we form with the patients. The pandemic and the recent crises really help demonstrate the need to have caring at the center of all we do. We need to get back to those basics. We need to help nurses to learn to care for themselves also before they go out and care for others. So when we went to go work on this new edition, we took Jeff's expertise of the clinical background, my experience with education, and kind of brought those all together in this edition of the book. And we also tried to level that appropriately. So you can go really to the next slide.
So of course, we can talk about all of the new things that have come out in the last decade that are now included or required in our curriculum. And it is somewhat sad to think that necessarily nursing theory has been kind of thought about as an optional inclusion in the last several decades. And we're here to say that that's a gross, misgrievance. It really needs to be thought of as an essential element to our curricula. And obviously, if we're going to do that, then we need to go back to the mother of psychiatric nursing and really talk about the person who started the whole trend of thinking about this as a theoretical formal process that nurses go through. For those of you that need a quick refresher, Dr. Peplau was really the first nurse to propose a theoretical practice model that guided how we practice mental health nursing. And from the late 50s, almost up through the late 70s, early 80s, Peplau's model was included in curricula and clinical practice. And her definition of nursing, I think, really is a nice launching point for today's discussion when she says part of her definition is that nursing is a significant therapeutic interpersonal process. And the word interpersonal really is the key word there. That's really what it is. She developed this theory from her work on her own graduate studies with Harry Stack Sullivan and adopted his model for nursing practice and found that it worked wonderfully for what we do as nurses. And you can go on to the next slide.
So when we talk about mental health and we educate the nurses of the future, we have to talk about the evolution of how we view mental illness and nursing's approach to care. And our view of mental illness has evolved over time, and so too has our approach to nursing care. So prior to the 1980s, we used to think of mental illness in the paradigms of the family system, the environment, and Freud, right? We think of Freud and the id, ego, superego, and all the defense mechanisms. And we still teach students about defense mechanisms today. But that thinking did evolve further in the 80s when the focus changed to looking at biology and brain chemistry, and we started to talk a lot about neurotransmitters. And again, we educate our students on that. We know that that's sometimes covered on NCLEX style questions. But when we teach our students, we have to inform them of this evolution. In particular, we need to have them think critically and to understand that our view of mental illness is going to continue to evolve, as will our approach to nursing care. Because as our understanding of how mental illness evolves, then our approach will change as well. Next slide, please.
So when we think about the evolution of our practice as psychiatric nurses, it really has gone from custodial care to a more active participant in critical thinking and clinical decision making, where our role previously was to make sure the beds were made, the patients were fed, they were bathed, we were attending to things on the ward. Then we evolved to be more of an active participant, mainly because of the nursing process. And if you think about the nursing process, that really is an art of applying scientific principles in a humanitarian way for the care of people through the nursing process, and serves as the organizational framework for the practice of nursing. It's interesting, historically, the initial reference to process in nursing was in 1955 journal article by Lydia Hall, and the term process was still not widely used. Then in 1960, Mandel, and then in Johnson in 1959, Orlando in 1961, all of those people started talking about the nursing process, and lo and behold, an actual formal structure to it emerged. It wasn't until 1974, though, that NANDA kind of ratified the whole process and added the official steps that came to be known as the nursing process. When you think about theory, and particularly use of Peplau's theory, we have to talk about intuitive-based practice, and we'll talk about that again here in a few moments. But theory, using her theory as a basis for practice, lends itself to intuition and intuitive-based practice. And that's a very important thing to think about, because Benner and Leonard discovered and published about this in 1984 and again in 2014, that cognitive acts such as imagination, creativity, intuition, reflection, and insights are important as a student progresses from novice to advanced beginner to competent nurse to proficient in family to expert, or the nurse with the deep smarts, as they called them. And critical thinking is really kind of the next step. There, evidence-based practice, we'll talk about that again in a few moments. Evidence-based practice actually migrated over from medicine in the late 70s, early 80s. There was this phenomenon that began to emerge in medicine called evidence-based medicine. And nursing, as did other aspects of healthcare disciplines, adopted it for its paradigm for practice as well. Critical thinking, refers just to a mindful, purposeful method of reasoning that is systematic, reflective, rational, and outcome-oriented. Basically, we are helping students understand that by going through the steps of critical thinking, first, what is it you're being asked to think about or believe? Secondly, you gather the information. Thirdly, you evaluate the evidence. Fourth, are there alternative explanations? And then you either accept or reject what it is you've been asked to believe or understand in the first step. By helping students understand the process of critical thinking and tying that together then with a theory-based practice enhances your clinical judgment, your clinical decision-making, because all of those then produce the outcome of critical thinking and clinical decision-making. When working with clients, really nurses must recognize the cues that exist in order to appropriately care for the client. Next slide.
All right, so on this next slide, it talks about key aspects of current educational and practice standards for psychiatric mental health nursing. So our practice is guided by QSAN, Quality and Safety Education for Nurses. And as you all know, that's patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, and safety and informatics. Our textbook makes nice linkages to QSAN in each chapter discussing clinical issues. Another key aspect educators are mindful of is the new AACN Essentials. And I'm sure all the educators out there are familiar with the new Essentials. There are 10 domains. You've probably already started with a gap analysis and are mapping your curriculum with the new Essentials. And our book covers the Essentials very well. And one just quick example is around the first domain of knowledge for nursing practice. That domain talks about applying nursing theory to practice and understanding the historical foundations of nursing as the relationships developed between the individual and the nurse. And as you just heard my partner, Jeffrey Jones, discuss, the foundation of our book is based in that theory, right? In Hildegard Peplow, which is all about relationship development between the individual and the nurse. That's just one very clear example of how the book supports the new Essentials. And another key element that many of us are talking about is trauma-informed care. And we cover those competencies as well in our textbook. So trauma-informed care, as you all know, shifts the focus from what's wrong with you to what happened to you. A trauma-informed approach to care acknowledges that healthcare organization and care teams need to have a complete picture of the patient's life situation, both past and present, in order to provide effective healthcare services with a healing orientation. So adopting that trauma-informed practice can potentially improve patient engagement, treatment adherence, health outcomes, as well as provider and staff wellness. And as educators, most of us use the nursing process. We don't need to throw the nursing process out, as you heard Jeffrey talk about before. Those of you who went to the NCSBN conference last month heard this, right? In fact, we can use the nursing process to help our students with the critical thinking and to facilitate clinical decision-making and clinical judgment. The linkage to the nursing process is very clear in our textbook, and there are also case studies that will help foster that clinical judgment. And so all of that, all of those key aspects can be neatly packaged in the nursing theory as well. So it kind of all fits nicely together in a package. All right, next slide.
So before we kind of show how this all ties together, how it came together for us visually, wanted to take a minute to talk about evidence-based nursing and intuitive-based nursing, because really everybody's heard about evidence-based nursing. That has been the popular buzzword for over a decade. But somehow intuitive-based nursing has kind of been shoved to the side and not talked about as much. So if we dig around and look at some of the evidence, we find that based on these studies, that particularly in 2007, there was an argument that was put forth that said, well, on one hand, the evidence-based practice movement has provided some structure to always incorporate best practices. We have to be careful because evidence-based practice has actually become a straitjacket for a reason, one that dissuades the user of intuitive and creative reasoning by reducing practice to the memorization of algorithms and protocols. And if we look then at intuitive-based nursing, this really occurs more when a nurse also uses theory to guide their practice. And it really is more than just a gut feeling. It is the result of a process based on a theoretical perspective, and the care experience is placed beside evidence-based nursing. So nurses integrate both analysis and synthesis and intuition alongside objective data when making decisions. So they're finding that nurses that can incorporate both evidence-based practice as well as intuitive-based practice are stronger clinicians. Okay, going to the next slide. This is a nice slide that kind of talks about the flow of this. If you look at Peplow's model, orientation, identification, exploitation, and resolution, and then that nursing theory gets translated into, helps explain, describe, predict, and also then prescribes how you create a care plan. It really integrates well, allowing for a more robust critical thinking process, resulting in higher quality clinical decision making. And the next slide shows this really seamlessly. When we were actually looking at this and putting this presentation together, it occurred to us that this slide almost was like that scene, and I think it was a Night at the Museum or a National Treasure, where Nicolas Cage finally arrives at the museum and the sunlight is coming in just at the right angle and it lights up the floor, and all of a sudden the answer to his way forward to find the treasure is there, illuminated. And this is almost exactly what that was for us, because when you look at the nursing process, the four step, the assessment, planning, implementation, evaluation, you can exactly align Peplau's model along with critical thinking and clinical judgment. They fit perfectly into the four-phase model of Peplau's theory and the four-step nursing process. This model of interconnectedness really shows how seamlessly that you can put this all together, and you are producing a way of thinking about delivering care that is actually very robust. You can go on to the next slide. It kind of, it comes to kind of fruition in thinking about Barbara Carper's work from 1978, when she started talking about how do nurses know what we know? What is it just the matter of learning things and memorizing things in a textbook or in a class? No, she said there is something very unique to our practice, and we both feel this is so important that we not lose this and that we retain this specialness about nurses. How do we know what we know? Well, it really is the empiric, ethics, personal, and aesthetic patterns that we learn. And it is the balanced convergence of using facts, morality, self-understanding, and immediacy in order to practice nursing. That statement pulls together everything that we have just talked about in the last two slides, and it helps the student become woke and aware, and all of a sudden gain this intuition and insight in how to practice rather than memorizing. It really is an awakening of a self-awareness of what it is to be a nurse and what it is to practice from not only an evidence-based perspective stance, but an intuitive stance as well. Okay.
So just to kind of wrap us up on this, Jeffrey, as you heard, is an expert and immersed in clinical practice. He also has great experience in teaching nursing as well. I have been teaching mental health for many years now at the undergraduate level. We've had similar interest and recognized that we combined our efforts into a textbook that would meet the needs of future nurses. And this book covers the essential key elements that you need. So we came together to write a textbook that returns to the art of a theory-based practice in nursing, a theory that puts caring and relationships at the center of all that we do as nurses. And that theory will also help to weave together critical components such as critical thinking and clinical judgment and clinical decision making. It highlights CUSIN, evidence-based practice, clinical judgment with case studies. The feedback that I have gotten from students is that this book is very easy to read and to understand, which was so important to us. And Jeffrey and I were very mindful in creating this book to make sure that the book was leveled appropriately. So we hope that you find this book useful and meaningful to your practice and to your students and to our future nurses. So at this point, yeah, go ahead, Lindsay.
Yes, thank you, Dr. Jones and Dr. Beauvais. That completes our presentation today. Unless anybody had any questions, feel free to type it into the chat box, or you can raise your hand. I don't see any. Let's see. The textbook is available. And yes, another question here regarding this presentation, it will be available by a recording. If there are no further questions, Again, I just want to thank everybody for joining, and of course, a very special thank you to Dr. Jones and Dr. Beauvais for their very interesting and informative presentation. You can find more information about the book and the today's presentation, the slide deck from the presentation. You can find that under the handouts section of the meeting here. So today's webinar, as I said, has been recorded and it will be posted to our YouTube channel. You will receive an email with a link to the recording in probably about a week. In the meantime, though, if you have any questions about the presentation or about the textbook, please don't hesitate to email me directly at lwhite@jblearning.com.